Hi, this is Dr. Ron Miller with Pursuit Physical Therapy, and today we're talking about frozen shoulder or adhesive capsulitis and what's the best way to treat it. We've been actually seeing a lot of cases of these lately where they've been misdiagnosed and not treated properly. So a few times we've seen people who have been diagnosed with frozen shoulder and it really wasn't frozen shoulder, and they responded quick and they were able to get their full range of motion back. And if a novice clinician is doing the eval and they just see that you have a decrease in external rotation, they're like, oh, it's frozen shoulder. A lot of times there's an underlying pathology that mimics that same pattern that you can clearly identify whether it's frozen shoulder or whether it's something else. But a lot of times, that people will get misdiagnosed and it's not really frozen shoulder. And they respond quick to treatment and they're pain-free in a matter of 2 or 3 weeks. Now, what to do if you do have frozen shoulder? What's the best way to treat it? Again, I've been seeing patients that have been told just to wait it out over 12 to 18 months and it'll eventually go away, and you're left with 60% of your range of motion and then it's fine. But who wants to wait 12 to 18 months for your pain to go away? So that's not really what the evidence says is best practice for frozen shoulder. A lot of times it's physical therapy and one injection. And most of the time that injection is not a simple injection that you're just getting for bursitis or impingement. The research shows that an intra-articular injection plus physical therapy will show great results. Sometimes you don't need the injection, but a lot of times it helps. It helps expedite this process. I'm seeing a patient right now who had true frozen shoulder. We were making progress, we plateaued a little bit and she wasn't responding well. And then the combination of her getting the injection plus me treating the cervical spine got her past that plateau. In a matter of 3 to 4 months, she has a range of motion back and she's doing advanced strengthening now and getting the results much quicker than waiting 12 to 18 months. Yes, true frozen shoulder is a complex case and it will take some time, but instead of waiting 12 to 18 months, you can start treatment now, get the proper treatment and the proper diagnosis, and get your results in 3, 4, or 5 months. So why wait? So I hope this educates you a little bit. If you have more questions about frozen shoulder and what is adhesive capsulitis, you can visit our website. If you have any more questions, put them in the comment box below or send us an email. And thank you very much for your time.